Awesome. Alrighty. Perfect. Can you see the slides I have pulled up?
Yes, we can see it.
Yes. Okay. Awesome. Well, thank you all again so much for letting me join. Really excited. I know we launched Virta Presentation County at the beginning of this year, 1/1. We would love to grow engagement. We currently have 7 folks enrolled in Virta. So excited to be here to talk a little more about our program, share some more information on how you can promote it too. And then, of course, I want this to be as helpful as possible. So feel free, if you do have any questions, come off me, let me know, drop them in the chat, or we could also answer questions at the end too. Perfect. So in terms of an agenda, just going to go a little bit, do an overview of Virta, and then talk about our member experience as well, and then wrap things up. So to kick us off, Virta, we are a virtual clinic to help members reverse type 2 diabetes, prediabetes, and also lose weight sustainably. So we've partnered, as mentioned, with UHC. So any member that has coverage via UHC, they can come into Virta and get care to help with any chronic metabolic disorders at no cost to them. And so we really focus on using a personalized nutrition therapy approach coupled with our virtual care to help members create a sustainable lifestyle change. That way they can lose weight, reach their health goals. And we always, end goal also is to get folks off of medication as well. So Virta, we initially started over 9 years ago as a clinical trial. So we are backed by research. And have been validated as well by multiple different entities. And we've also been proven to work in just about any demographic. So we want to make sure our program is personalized and sustainable for all. And so one thing that sets us apart and makes us different is that our main focus is really addressing the root cause of chronic metabolic disorders. So cardiometabolic diseases such as type 2 diabetes, obesity, and prediabetes normally have the same root cause, which is a diet high in processed and carb-heavy foods that can ultimately affect our biochemistry and damage our metabolism. That's what leads to type 2 diabetes, overweight, and prediabetes. And so if you think about our current healthcare system right now, we typically tend to treat these diseases separately and really focus on just treating the individual symptoms or conditions and just prescribing more medications. However, here at Virta, we have really found that by improving nutrition and teaching our members how to eat healthy foods that fuel their body, we can begin to heal their metabolism and reverse these conditions. And because we are healing the metabolism, we're also seeing improvements in other comorbidities, as you can see at this top of this tree, such as MSK, hypertension, heart disease, and so on. We also have published data showing improvements in every single one of these conditions too. And so that is really what makes Virta unique, is because we're not just looking to treat the symptoms of diabetes or prediabetes or manage the condition. We really want to help our members reset their metabolism in a safe and sustainable way. And doing that, not by, really focusing on any diet, but really focusing on what our members are eating, not how much, and helping them make sustainable changes to reach their health goals. And so for Racine County, we do have our sustainable weight loss program available. So that is open to folks who have a BMI greater than or equal to 25, or anyone who has an A1C in the pre-diabetic range, which is 5.7 to 6.4. And then we also have our flagship type 2 diabetes reversal program. So those are the two main buckets that folks can come to Virta for care. And whenever they come into the program, we'll put them in the right bucket depending on their diagnosis criteria, but that is the criteria for members to enroll. Awesome. So looking in a little bit more about how Virta works, we really have kind of two key components of our program. the first that I mentioned is that personalized nutrition therapy. And so this is based on carbohydrate restriction. Carbohydrate restriction has been cited by the American Diabetes Association in their evidence-based standards of care for the last 4 years running, and it is included as a first-line therapy for type 2 diabetes. So this same therapy is used to care, we use the same therapy too to care for patients with obesity as well and prediabetes. And so we found it to be extremely impactful and have done multiple studies to really show that as patients reduce their carbohydrate intake, they really start to train their bodies to switch from metabolizing sugar to metabolizing fat as their primary source of energy. And this in turns reduces their need and dependence on medication and also helps them lose weight to reach their weight loss goals. And so one thing I always really like to emphasize here is that I know I said carbohydrate restriction. This can be intimidating, I know, to a lot of folks. So we're not asking members to completely eliminate carbs from their diet, never eat a piece of bread again or chips. We really want to help them find their own personalized carbohydrate tolerance. So reducing that intake at a level that they feel comfortable with, that will help them reach their health goals. And so I'll go through the member experience, but that's something where the coaches will really talk them through that and help with those decisions. And so the second piece of the puzzle that we have is our advanced telehealth model. So what that means is that members are going to have access to their full Virta care team, which will consist of a health coach and a Virta health provider right in their phone, right in their pocket on their smartphone. So we will send our members everything that they need to be successful in the program, which includes a Bluetooth connected scale and blood glucose and ketone meter. That is where folks can log their biomarkers. All that data is automatically uploaded into the Virta Health app, and our physicians and health coaches will be monitoring those biomarkers on a daily basis, and then helping them with their health goals, making those nutrition changes, and then deprescribing medications once clinically appropriate. So putting it into motion, here is a overview of the first few months of Virta. So we'll share some additional communication assets that you can use to promote Virta on your different sites. But when members come in, they'll go to the Virta Health landing page and they will start their clinical intake form. This is a brief form, very similar to what you typically fill out at a new doctor's office, just asking about you, your goals, and your health history. And from there, they will be able to get connected with one of our enrollment advisors, and that is where they will learn more about the Virta program. If they need to get any recent lab work done, things like that, we'll help them get that scheduled. And Virta also fully covers the cost of any lab work needed. And we will get them set up to meet with a clinician for their initial clinical intake call so they can get approved and get started with Virta. Once they have that clinical intake call, they meet with the provider, talk through their goals, make sure Virta is a good fit from them. We will then ship out that welcome kit that's going to include everything that they need, and they will be able to access all of our resources on the Virta Health app and start connecting with their coaches to get started. So within that first couple weeks, that's where members, they'll meet with their health coaches and they will really develop that personalized care plan. You know, for some members, they might be ready to jump in right away, start reducing their carbohydrate intake pretty significantly. So we can help with that. However, for others, you know, we understand there's a lot going on in life. And so we want to be able to meet members where they are. So we can also start small with baby steps too, whether that is, you know, instead of drinking 4 Dr. Peppers a day, maybe seeing if we could switch to Diet Dr. Pepper or, you know, go down to 2 Dr. Peppers a day, a couple of days a week, and really just start logging their biomarkers, seeing the impact on their biomarkers of these small changes. So that is where our team really comes in, has those hard conversations, really finds out what matters most, and what will work for the member. So it's not extremely restrictive where members have to follow an intense meal plan for the first couple weeks or anything like that. We want to make sure these changes that we're making are sustainable and will fit into our members' lifestyle. So that is the personalized care plan, and members will be working with their coaches directly on any questions. They'll also be logging their biomarkers. This is one of my favorite parts, I think, of the program because members can see that change, those changes that they're making and how they're impacting their blood glucose, ketones, as well as their weight right away. And it is automatically tracked. And that information will also be monitored by their health coach and Virta clinician as well. So if any medication dosages or things like that need to be updated, we can step in to update and help that, as well as, if there's ever any side effects or things like that, we can help members with that too. Right. So looking in a little bit deeper, our nutrition therapy, as I was talking about, we really want to meet members where they are. So we are focusing on educating our members on what to eat and not really focusing on how much they eat. So they don't need to meet a certain a calorie limit or step count per day. So we really just want our members to be eating real foods, healthy fats, and kind of ditching that high processed, high sugar um, carbs and foods as well. So want folks to be eating real food that really fills them up. We don't want people to be starving as well. So that's why, fat is encouraged. So having bacon and butter, there's no restrictions on that because we want members to eat what satisfies them and makes them feel full so they have energy for the rest of the day. And we've also found too that that can really help reduce cravings as well. And then, as I mentioned, most importantly, we want to make sure it is sustainable. So that's why every member has a dedicated coach where they can connect with, talk through any challenges. Within the Virta Health app, too, we also have some really great resources. So members will be able to go in, they can get grocery shopping list of Virta friendly foods from Walmart, Costco, Trader Joe's, things like that, if they're looking for ideas. We have Virta-friendly options of basically just about any recipe, or we can also use AI to help members make any recipe that they have, how they can make it Virta friendly too. So we have a handful of resources where folks can go in as well as they can lean on their coach. And we have a community aspect too. So if you want to learn from other folks on Virta or just, are in a hard time and need some support, there's a lot of different support options for our members. So before jumping into eligibility, I want to pause and see if there's any questions.
I do have a couple of questions. Can you explain what it means exactly? Because I don't really know, glucose monitoring, and I don't really know what that all looks like. So can you explain what the ongoing biomarker monitoring looks like? So if an individual, like what types of materials are they sent? How do they use them? And then how do they upload that information into the app?
Yeah, great question. So our welcome kit, it does include the blood glucose meter and a ketone meter. So that is a combined device. I'm gonna switch to a slide real quick so I can pull that up for you. Um, and that is where members, it is a finger prick. So they will prick their finger and put it on a testing strip. And this little device here, the blood glucose meter, that will automatically upload that data into the Virta Health app. So you can see your blood glucose and ketone readings. For that, it's going to really depend on the program with the member. If you're a type 2 diabetic, we will ask you to log more blood glucose and ketones more frequently compared to someone who might just be in the program for sustainable weight loss. So that's something, if I know some people blood can make you queasy, you don't want to poke yourself. So that's something you can talk to your health coach on. But we've always found it's very insightful for members to track this just so they can see how their habits are impacting these outcomes or impacting their health and these biomarkers. So that will be included as well as the digital scale that will automatically update anytime you step on the scale.
Well, that's pretty cool. So like if they eat a meal, say, then they would just like do that, prick their fingers, see how that meal affected their blood levels, and then that all gets uploaded onto the app. And then I'm assuming then the coach that they're working with can see like, okay, it looks like this particular meal kind of spiked your insulin level. So maybe for the next time we kind of adjust that meal. Is that kind of how that works?
Yep, exactly. So able to kind of track that impact on the numbers day and night to see exactly how what you eat impacts your blood glucose. And so that's what we found. It's really insightful for members to learn from. You could think eating a banana and oatmeal doesn't really have that much of an impact on your blood sugar, but then after your first reading, you can see it most likely produces a pretty high spike. So that meal that you thought was very healthy may not be the best for you if you are carbohydrate intolerant.
Be mistaken, but I thought I had heard initially, and maybe it was just for those who were diagnosed with type 2 diabetes, that they maybe sent an actual continuous glucose monitor. Is that correct?
At this time, we do not offer CGMs, a continuous glucose monitor. If a member has one already, they can log that data in the Virta Health app. So we'll certainly take those readings. They'll just have to input what their glucose is in the app. We don't have integration with any right now.
Okay, I see.
Great questions.
Yeah, I thought I had another. Oh, you were talking about low carb, and I just wanted to check with you because I know keto is pretty extreme, but you're not considering this a keto diet.
Correct. Yes. So keto is exactly what you said, a diet. And our approach is really what we're trying to do as a lifestyle approach. So we do follow a kind of keto based approach of finding, low of what folks can consider keto. So low carb, moderate protein, high fat. However, that's going to be individualized to each and every person. So what may work for me may not work for you. And so we're not making members stick to a strict keto diet or anything like that. We really want to help them understand how carbohydrates are processed and digested in their body and find their personalized level of carbohydrate that they need to help reach their goals. And so this is just an example of the Virta plate where you can see we of course want folks to continue to get carbohydrates, especially from non-starchy vegetables like veggies, leafy greens, red bell peppers, cauliflowers, things like that. And then also have moderate protein and added fats too, as well as salt and spices because we want to make sure all the food is still satisfying and fulfilling too. So we at every meal we typically teach members to aim for a combination of these four components, and we're happy to help create meal plans, things like that. But really, we would just want to help members use food as medicine, and they are not required to stick to a super strict keto diet. Virta is not keto. We really just want to help folks kind of reduce that carbohydrate intake that helps them reach their health goals, and that's going to vary depending on each person as we're all different.
That makes sense. And then my last question is there any difference to someone who enrolls in this program if they are type 2 diabetic versus if they are not type 2 diabetic but considered obese?
Yeah, good questions. So, the enrollment process, everyone's going to go through the same kind of front door. So it'll be the same enrollment process. The biggest difference between someone who is type 2 diabetic and someone who is pre-diabetic or overweight, um, it could be the approach is very similar where we're looking to do the low carb approach. But those folks who are type 2, they may just be asked to log their biomarkers more. We also there is a dedicated clinician for them as well, who they might meet with more depending on the level of their diabetes, if it's uncontrolled, managed and controlled. So they'll likely have a little bit more provider insight where they will work with their provider one-on-one if they are on any diabetes medication. We want to make sure as they start to lose weight and reach their health goals, if adjustments need to be made, we keep that all closely monitored. But overall, the core principles of Virta is the same across programs. The member experience is the same across programs. everyone has that provider oversight. So they have a clinician and a health coach working with them to manage medication, side effects, things like that. One of the biggest differences is just that folks with type 2 diabetes, they might have a little bit more medication changes, and then they might be asked to log their biomarkers a little bit more frequently too.
Done with my question.
Oh, sorry. I think I heard a little bit, but I might have been breaking out on that last question.
No, that's probably my fault. Sorry. Thank you. You've answered all my questions.
Awesome. Yeah, great questions. And one additional thing too, you can really think of Virta as a diabetes and weight loss specialist. We are by no means here looking to replace your relationship or any member's relationship with their primary care physician. Whenever members enroll, we do ask for their primary care physician's information, and we will work with them to fax care updates on how you're doing in the program, any medication changes, things like that. So we're happy to work with any existing care teams too, um, within the program as well. So awesome. Looking at the eligibility criteria, so Virta is available to all employees and adult dependents over 18 who are enrolled in the sponsored UHC medical plan. A couple of additional details is that folks do have to have you do have to have the type 2 diabetes, prediabetes, or a BMI greater than or equal to 25 to enroll. And then folks do have to have a smartphone to get started with Virta. So we require that smartphone because we do most of our interactions via the app, and then also require the Bluetooth for them to log their biomarkers. And this is mainly just due to patient safety as well. You know, if our care team's making any medication changes, things like that, they want to be able to get in touch with folks pretty quickly. So smartphones are required, and then Virta is available in English and Spanish right now as well. Awesome. And then last but not least, I did also just want to promote our marketing toolkit. So if you are interested in sharing more information about Virta, we can get this sent over, but we do have a toolkit that includes a handful of resources that are available, such as slides like the overview I went over. We have some videos of unboxing our starter kit, demo videos, testimonials, things like that. So if you're ever looking for promotional content to send out, this is a great place to go where you can find a lot of different information. And then we also have some fun resources too down at the bottom under media, such as our Berta Health recipe library. So this includes a handful of different recipes, and we have a recipe book too, as well as our podcast and blogs as well. So this is something we try to update pretty frequently. Um, and if you ever need any information, you can always reach out to me too, but wanted to pass this along. So that is majority of the information I had to go through. And then also, last but not least, for folks who are interested in get started, this is the landing page that they can navigate to start that clinical intake. It's virtahealth.com/join/UHC. Any other questions?
Can you tell us what type of data you have? Like what's the success rates for people who are diabetic with the reversal of that diagnosis?
Yeah, absolutely. So we have a handful of clinical trials that we have done with our study or and clinical studies. So at 1 year, we typically see folks drop their A1C by at least 1 point. And then majority of folks get off about 47% of their diabetes medication. A handful of members were able to help them reduce insulin or eliminate insulin altogether too with this and get them from the type 2 diabetic range down to the pre-diabetic or even no type 2 no diabetic, get them in that normal blood glucose range. And then on average, members who complete at least anywhere from 8 to 12 months in Virta, we typically see folks lose 5% body weight or more.
And is the typical, if someone enrolls, is it like a 12-month? I know that they don't have to stay in it for 12 months, but is that pretty much the enrollment timeline?
Yeah, it's really up to the member. We don't have any set guidelines. We do see that majority of folks stay in the program in our sustainable weight loss anywhere from 6 to 12 months. Type 2 diabetes, it's normally 12 to 18 months. But it really is up to the member. We have folks that have been enrolled in Virta for over 4 to 5 years. So depending on their goals, a lot of folks like to stay enrolled because they really like the resources in the community and accountability of our coaches. But we'll really work with members on a one-on-one to determine when's the best time. Some folks come in within 6 months, they're like, I got Virta, I can do this on my own, and they can just continue on with those lifestyle changes.
I'm sorry if I missed this, but what is the cost to the program? Is that something that's all ran through United Healthcare?
Yeah, great question. So there is no cost to the member at all. So UHC and Racine County, they fully cover the cost of Virta for their members. There's no cost to the member at all or the dependents to get started.
Okay, thank you.
Mhm. Great question.
Anybody else have any questions for Sophie?
Awesome. Well,
Oh,
I was just going to say, if any other questions come up, please feel free to send them my way. We really appreciate the partnership, just to continue to promote Virta. If you ever want to do a larger webinar too, I'm always happy to help out as well. So please keep me in the loop and really appreciate the opportunity to connect and all the great questions.